Hey, I'd like to welcome you to another episode of the Mission Matters Business Podcast, your source for all things business. My name is Adam Torres. You can follow me on Instagram at AskAdamTorres to keep up with our book releases, book tour schedule, signings, all that other good stuff. Always love to connect with you there. And as always, if you'd like to apply to become a co-author of one of our upcoming books, just head on over to the website, missionmatters.com, and click on Become an Author to apply. All right, so today I have Dr. Alejandro Badia on the line, and he's founder and chief medical officer over at OrthoNOW, and he's also author of Healthcare from the Trenches, an inside account of the complex barriers in U.S. healthcare from the provider and patient perspective. Dr. Badia, welcome back to the show.
Thank you, Adam. Appreciate it.
Oh, man, so excited to get into today's topic. So we're going to get into this new book, Healthcare from the Trenches. First off, congrats. I saw that you already hit #1 on Amazon new releases for the book. So congrats on that. It's a huge accomplishment.
Thank you. Thank you. Yeah, it's pretty incredible. Like, even with a pre-order, I think if the topic interests people, that's how that happens, because the book isn't even officially out.
Yeah, I love it, and we pre-ordered a copy over here already, so I'm excited to read it myself. I haven't read it all yet, but before we get into the book, I want to go further into it. But I don't want to assume. I know you're a return guest, but I don't want to assume that our new listeners caught your first episodes. So let's just give a quick overview of what you're doing over at OrthoNOW, please.
Sure. Well, obviously, the COVID-19 pandemic threw everyone a curveball, particularly those of us in healthcare. There were definitely some challenges in this, which I relayed the first time we spoke. And with COVID, it really exacerbated that. But what soon happened, we realized that people didn't want to go to the emergency room anymore, and orthopedic issues still occur. That's one of the things the public needs to understand is, while the hospitals were full of patients, being ruled out for COVID or getting treated for a bad stage of that, there are other medical problems that continue, and orthopedics is just certainly one of those big areas. So we were doing a lot of telemedicine, which for us was nothing new. So we have been innovators and certainly early adopters in many areas. So when this happened, we have been very busy with what I coined hashtag teleorthopedics. So it's really telehealth for the musculoskeletal problems. And just yesterday, we reopened our brick and mortar, and we are still looking for the right strategic partner and investor for us, because we are going to go national, but that's it's contingent upon that.
Yeah, I was thinking about you guys as this all kind of unraveled, if you will, the whole pandemic thing, and I'm like, geez, I was thinking about it. I'm like, man, one of my worst nightmares right now would be like spraining my ankle or something else, and you're like, or this other thing that's not necessarily life threatening or something else, and you're like, you want to go in, and you're like, man, but I don't want to be around a bunch of sick people, or like, I was like, that was one of my major things of like this whole thing was don't get sick on anything else, because I don't want to be around that environment or anything else. So glad you brought all that up and how it's working, and glad to know that you guys have been pioneering telemedicine for a long time. So glad to see you're still able to take care of and help your patients there. I do want to spend some time on the book, so let's just really jump right in here. So Healthcare from the Trenches, an inside account of the complex barriers in U.S. healthcare from the provider and patient perspective. What was the inspiration for this book?
Well, the inspiration was really monumental frustration, and the fact that I think people, the lay public, doesn't really understand what we face in trying to deliver healthcare, and patients who consume a lot of healthcare certainly know that it is really a grind to get things done because of the amount of bureaucracy and hurdles that are placed in your way, and yet we have the second most expensive healthcare system. Well, the most expensive healthcare system, but I'm saying we're twice as expensive as Norway in terms of percentage of GDP. So we obviously are, we're doing something wrong. And the discussion, you see all this even with COVID. I mean, you see Fauci on the every day, and Fauci, believe me, I was involved when the AIDS hit, and I trained at Bellevue Hospital, New York. And Fauci was a big name then, but the people who really can address how to treat, a pandemic efficiently at the grassroots level, are the people actually providing the care. It's not, it isn't even Dr. Fauci. It isn't the CDC. It's, you get, 10 ER physicians and nurses and techs in a room, and you say, okay, how can we do this more efficiently, more cost effectively, and with better results? And it's like that with healthcare. And we do not have those kind of dialogues in this country. And COVID-19 is exposing that, because now people actually want to hear from us in the trenches. You'll see CNN interview somebody, in an ER who looks like they're, dressed for battle. And I think that society now, the whole, we're heroes without capes sort of thing. This is really a new perspective. Or I should say an old perspective that's come back. Last 2-3 decades, physicians were not held in the same sort of esteem. And really, several people entities are responsible for that. Largely the insurance industry. Let's be very frank. And that has really hurt healthcare. Not that we don't. Obviously, we need insurance. We need big hospitals. We need pharmaceuticals. But we as the clinicians, we've gotten lost in the shuffle.
Yeah, and I think one of the things that most people have, and myself included, were that I think some people took it for granted. I'll say myself. I mean, I maybe took it for granted. I didn't really understand, because it's always there. It's working. It's functioning. You can go in the doctor when you want. You can do these things, but to really think about understanding that that's a service being provided to you, and the luxury that we have of being able to walk into the doctor. I mean, it's an amazing thing. I know I have a newfound, and not that disrespect, but I have a newfound respect to being able to go in and have somebody there to take care of me, like that I didn't maybe think about in the past.
That's true, and in the end, our core work is, I won't even say the same as before, because actually it's better. We know so much more. It's amazing, and the same for a lot of my colleagues in other countries. I mean, the world has become very much a flat place, which is good, okay, and that's due to several reasons. But what's happening in the U.S., which our colleagues don't get quite as much of, is the regulatory and bureaucratic battle. The money being spent in places that actually isn't even relevant to direct care, and that is the problem, and that's what we need to talk about. And that's what this book does, not by presenting a lot of statistics, which I throw that in there. We have other contributors, including another orthopedic surgeon, also Cuban-American, who wrote the foreword, and he's written several books on healthcare, and he's quoted in there quite a bit. But I'm talking about the everyday stories that will get people to say, "Wow, there's something wrong here." I don't have the solution for it, although the last chapter I do present some of my perspective and that of quite a few other clinicians. But it's telling the story at sort of the grassroots level, and that's what the book set out to do, and I think really accomplishes it.
What are some of the major takeaways that you want the average everyday reader that picks up this book to walk away with?
Well, I don't want to give too much of the book away, so I will tell you in general. We talk about different. It's set up into chapters where we discuss a certain entity, and we say how we can get it to work better. For example, government. So we talk a lot about Medicare and the ACA, the Affordable Care Act. Then we talk about even on a city and county level how there are barriers where we could actually provide healthcare a lot more expeditiously and cost effectively. And our own government, it's sort of the same thing, obviously, with insurance companies. I mean, I blow away the whole concept of authorization. It's an absolutely, really ridiculous concept, and I expose that. So what you're going to see is a number of different basic concepts that I spell out. Let me tell you just two quick things that happened today. I mean, it's a constant. If you're in the trenches, this is a constant frustration. Today, CMS, which is Medicare, Center for Medicare Services, just told my my collections gal, who, I have to have a full employee just to bill and collect, which is crazy, 2 employees, told me that Medicare just denied payment for a second finger. I did a fusion for these arthritic joints that are very painful, and I'm able to do 2 at a time in the same hand. Well, and this is actually the first I've heard of this, is that Medicare didn't pay for the second finger. So
wait a minute, I can't. Hold on.
Well, I'll tell you what it does. If I was a little bit less, if I was not as, if I was less ethical, I would say, okay, Mrs. Jones, we'll do your first finger. The second I remove the pins and that fusion took, then 2 or 3 months later, we'll do the other finger. Well, now we're charging Medicare 2 anesthesia services, 2 visits to the operating room, and yet I'm being what they should do is they should say, Dr. Badia, for doing the second finger, we'll pay you 20 or 30% more because you're able to do more in one sitting. I mean, think about how absurd that is, because both fingers needed it. I mean, they were both exquisitely painful. The whole thing takes me 30, 40 minutes to do, and I solved that patient's problem. And yet that's how I'm rewarded.
Wow.
Workers' compensation, there's a big company called Corvell. I doubt anybody from there is listening, because I don't think these people really get involved in caring about how we can make healthcare better. Corvell is a big workers' compensation. So I set up a meeting with them last month to try to talk some of these issues and teach them how we can actually save them money. For example, OrthoNOW is a no-brainer. Most workers' comp patients go to one of these general occupational health clinics where a very well-meaning physician is seeing over 90% orthopedics, but they don't have orthopedic training. So inevitably, in most cases, it ends up being a second visit to somebody like me. Well, we disrupted that totally. So, but Corvell in many ways has really, just really mistreated the clinician who's trying to provide the care. So I just found out an hour ago. I had a second meeting. I think it was either for today or tomorrow. They canceled it. They canceled the other one same day. So like I'm not that busy. So an insurance company can literally cancel a meeting with me last minute.
Wow.
I mean, think about how outrageous that is. Now, what recourse do I have? Well, here's the recourse. I'm telling the American people in a book. That's the recourse.
That's awesome. I love it, and I'm excited. Well, you have me all fired up to read this book, Dr. Badia. I know I had it, but now I'm like, wait a minute, what else don't I know? You got me fired up over here.
That. It's full of stories like that you wouldn't believe. I mean, the malpractice chapter will make people cry. I mean, there's one.
My God.
A colleague of mine from Philadelphia tells 3 different stories that each one of them is more unbelievable than the other. I mean,
wow.
He got sued for a patient who had a stroke 2 years after he did a wrist surgery. Like, what does the stroke have to do with it? You know what I'm saying?
Wow.
This is something that we need to talk about.
This is good, and I'm glad that you went through and compiled and brought the stories to light, and I'm excited for this book to be released and to go live. That being said, if somebody's listening to this and they want more information on OrthoNOW and to learn more about what you're doing, and also to learn more about the book, I mean, what's the best way for people to follow up and to connect?
Sure. Well, the book, just to make it easy for people, there's a pop-up on my website now. My website's easy, drbadia.com. So that's DRBADIA. And at drbadia.com, when you get to the homepage, there's a little pop-up our webmaster put that takes you to the right page, and then you can purchase pre-order the book on Amazon for a big $2.99. That's the Kindle version. I'm learning about all this stuff because I've always published in scientific journals or chapters in textbooks. So this is the first sort of layperson book I've written, and I don't know yet the release about the paperback, but I have a feeling we'll probably be going with a hardcover as well. But the Kindle version is available for purchase now, and it should be officially released. So if you buy it now, you'll get a link to your email, and that'll be in about mid-June.
Fantastic.
And in terms of OrthoNOW, which is certainly mentioned in the book, of course, is just one strategy to save time and money in healthcare. OrthoNOW's URL is simply orthonowcare.com.
Perfect. Well, Dr. Badia, really appreciate you coming on the show today and sharing more about the new book and, of course, all the great work you're doing over at OrthoNOW. Awesome having you back on the show. And to the audience, as always, thank you for tuning in. Hope you got a lot of value out of this. If you did, don't forget to head to the website, missionmatters.com. Check us out there. Also, YouTube channel. If you're watching us there, definitely leave us some comments on the video. And don't forget, subscribe to the podcast. Love to have you as a return listener. And Dr. Badia, thanks again for coming on the show.
Thanks, Adam. It's really a pleasure to be with you and share information with the public. Thanks.